They come in the morning and they sign the treatment plan, and they go downstairs and they get a pre-medication, and that's to support heart function and any pain during the procedure. And also a little bit of relaxation, because when they come to the vet they can be a little nervous. They get an IV catheter. The IV goes in their arm just like it would with you if you were getting anesthesia. And then we give them an induction dose of anesthesia, which makes them fall asleep. Put in a breathing tube into their throat.
In the room, the technician gets the animal all hooked up to the anesthetic equipment, and they are monitoring their vitals during that time. Blood pressure, electrocardiogram, breathing, heart rate. While the technician is getting things set up, they also clip the abdomen and they scrub it with antiseptic scrub. Once the animal's stable and everything's going, then the doctor goes in and scrubs as well. And we put on our gown, which is protective covering for the clothing, and also sterile gloves, and go into the procedure.
This is where the abdominal muscles come together and form a ligament. We really try hard to make it as close to a university setting as possible. We make sure they come back for suture removal. It gives us a chance to evaluate this surgery a week after it's healed.
As soon as that procedure is done, we get the animal into a normal position out of a surgical position. The nurse is monitoring the vitals during that time and watching for the anesthetic to wear off so that the animal starts to swallow on their own. Once they have a normal swallow reflex, then we can remove the intratracheal tube, and then we monitor them while they're recovering. They're never left alone, even for a second, until they're fully awake from anesthesia. They get wrapped in blankets and towels and get heating pads and get held and lots of attention until they're fully awake from their anesthesia.
And we just assume here that they're just as painful as we are. So they all get pre-medications with morphine type medication. They get monitored for pain, their respiration and their demeanor, and automatically they get a dose of pain medication after procedures, and then they get another dose of a different pain medicine if they're staying overnight or not. They go home with a non-steroidal pain medication as well.